Welcome back to Flashpoint. This week marks 4 years since the first COVID case was detected here in Mecklenburg County. But new guidance seems like we've turned a corner in fighting one of the largest pandemics in world history. Joining us now, Mecklenburg County's Health Director, Dr. Raynard Washington. Welcome back.
Thanks, great to be here.
So 4 years after this pandemic first started here in Mecklenburg County, where are we at today in fighting the virus? What stage are we at now?
We continue the fight. As you know, it's March now, and so we are starting to see some improvements in our COVID metrics that we do have. Specifically, our hospitalizations are declining, as well as our wastewater surveillance. We're seeing lower levels of the virus in our wastewater, and so we are making some progress for this season, this respiratory viral season. We're seeing the same thing as well with other respiratory viruses, the flu as well as RSV, and so we are. Spring is coming, and so hopefully we'll be going back down to lower levels of transmission. But there is still COVID in the community. There's still flu. And so I do encourage residents to take caution.
The CDC says you don't need a quarantine if you're feeling okay. You talked about testing. Should people still be getting tested for COVID?
Well, I think the reason why you test for COVID, there are a couple of groups that are particularly important that they do test. Folks who are more vulnerable to severe disease because of COVID, it is really important that they test to determine whether or not they need to get treatment or not. And so the treatments for COVID and flu are different. And so for people who are more vulnerable, are older adults, people who have complex chronic conditions or have autoimmune conditions, or even young children, it might be important to determine which virus they have so that they can be treated properly. But other than that, I think the CDC's guidance is trying to simplify the message to the public and keep it really focused on if you're sick and don't feel well, just stay home and away from others until you start to feel better. And then it's also still important to take precautions when you come back out of the house. So, we encourage people to wear a mask until at least several days after they've come back out of the home. And so all those things are still really, really important, but just trying to simplify the guidance for folks so people know, hey, if you're sick, you feel like you have a cold or fever, just stay away from other people.
Do you think the county and the state is ready for the next pandemic?
We're doing our best to prepare. As you know, the federal government has made unprecedented investments in local public health infrastructure over the last couple of years. And so we're trying to make sure that we stay prepared. Here locally, we had an after action from the heart of the COVID response and have been working to implement a number of infrastructure improvements in our department's work so that we can make sure that we are ready for the next one. There's a lot of work happening, not just here in Mecklenburg, but across the state and across the country to ensure that we have a public health system that's invested in and has those resources available to folks before we get into a situation where we need them and that we're prepared.
Because we've certainly seen how important it is to have a public health system in a situation like this. You mentioned tracking wastewater particles and things like that. From your understanding, are we going to continue to track these things and hospitalizations going into the future, or at some point are we going to stop tracking those things?
Well, we're going to continue to track them. So the wastewater surveillance program is actually is one of the I think really a great thing that came out of our COVID response activities because we've built infrastructure to be able to track surveillance, to look for other types of infectious diseases, not just COVID. And so that allows us to keep an eye on levels of infections in the community. Even for Mpox, we've been able to look for and detect Mpox in wastewater. And so it allows us a new surveillance tool for some of these conditions where we're not able to do universal testing in the community. It gives us a signal of where we are in terms of cases and disease burden in the community. So I'm actually pretty excited about the fact that we'll be able to continue this work here. And there's a lot of work happening across the country to help us understand how to best use the technology, how to best use the information, and how to best let it inform our action when we're making decisions about public health mitigation measures.
You mentioned Mpox. That was going to be what I brought up next, formerly known as monkeypox. Are we seeing cases tick back up? Is that what's happening?
Yeah, unfortunately, we are. For the last several weeks here in Mecklenburg, actually a couple of months now, we have been seeing an increase in cases. As you know, we had a pretty large outbreak about a year and a half ago here in Mecklenburg, across the state and across the country. And we are starting to see, for the last several months, we've seen cases of Mpox here locally in the county. And it is very concerning because most of the folks, the vast majority of the people who have been infected recently have not been vaccinated for Mpox. And so it is important important that we continue to get the message out to the community that it's still circulating, though it's not at the level that it has been in the past. But it's really important that we take proactive steps to avoid future transmission. I'm also really concerned because we've had a number of cases that have exposed a large number of residents. And so, as you know, in the last couple of months, we've had about 16, 17 cases, and there have been more than 120 exposures attached to those cases, including a large number of children. And so for us, it's just really important to get the message out that people are looking for Mpox, that our residents who are at high risk, those who are sexually active, have multiple sexual partners or high-risk sex or anonymous sex. It's really important that those folks come in and get vaccinated, and that we also make sure that people are looking for signs and symptoms of Mpox. Obviously, the most obvious symptom is the lesion, but if you have any lesions or a rash or a new rash on your body, it's important that you go in and get checked out.
Rewind for a second. You mentioned kids being exposed. What do we know about that?
So no different than, one of the things we do here at the health department, our communicable disease team works really hard to make sure that we're able to identify potential exposures of any real infectious condition. And so it's no different with Mpox. We work with cases to identify where they've been, who they've been in contact with while they were potentially infectious. And then we do a complete investigation and follow up with those individuals who were exposed. In the case of recent cases, we've had some cases who've been in settings where children are, and whether it be household or in the community, and unfortunately a number of children have been in close contact with those individuals. And so it's just really important that we take precautions, and that folks, again, if you have a new rash or lesion, you get checked out, and that you take those precautions to isolate when you're directed to by your healthcare provider.
Should parents out there be worried, or do you view these as a few isolated cases?
These situations are really isolated, so it's no. I don't think parents should be alarmed or worried at this point. Any family that would have been impacted potentially or potentially exposed, we have notified from the health department, and so they are aware and monitoring, of course, as directed. So no, there's no global worry. And again, we're still talking about a really small number of cases, and relatively speaking, a small number of exposures. But it is more than what we have seen per case on in the prior outbreak that we had last year. And so I want to make sure that we're communicating clearly with the public about what the risk is, and folks are on alert and cautious.
All right, Health Director Raynard Washington, thanks for coming on. We appreciate it.
Thanks, great to be here.
Still to come here on Flashpoint, North Carolina forgiving decades-old debt. Next, why the state's being so quiet about it.